everyone. You are at Boston Carnivore, Diane Ladd, and I am here to welcome my very first guest, the real Dr. Nelson. Hello, Dr. Nelson. I'm so happy to see you today.
Thank you for having me here. Thank you.
Yes.
I'm honored to be the first.
Oh, you're so sweet. So, I'd like to talk to the listeners and tell them what we're going to do today. So, first, I want to learn about Dr. Nelson, the man himself. Maybe find out a little bit about the carnivore diet, and then be sure to stick with us until the end because Dr. Nelson and I will be playing a little game that I call Carnivore Fact or Fiction. So I'm so happy you agreed to do that because this is going to be a lot of fun.
Okay.
So I want to ask you, why are you a doctor? What made you become a doctor?
So, ever since I can remember, and most people's memories don't go back from the age of 3, and some other people don't remember before 6 or 7, even.
Right.
But I do remember November 22nd, 1963.
Wow.
Uh, do you recognize the date?
I'm not sure. Let me know more. What's going on?
It's a very dark day in the history of the United States.
Ah,
November 22nd, 1963, Texas, JFK assassination.
okay.
Now, the reason I remember that is not because at the age of 3 I knew anything about politics or presidents. Don't know who this guy was. But my mom was washing, doing the laundry in the back of the house and listening to the radio. And all of a sudden, she starts screaming and crying because they killed the president.
Yeah.
Right? So this is how I know that about that day.
Wow. It
But
sticks out in your mind. It really, you can really remember it because I think a lot of people, when there's something that tragic that happens, that just gets seared in their memory, and that's how you remember that.
so even around that time, or even before that, I know I had decided to be a doctor. Why? Well, I had an older brother. He was, I believe, 6 months old in 1958 when he went to his doctor and had the regular checkup and inoculations.
Mm.
And he developed a rare complication from that.
Mm.
Long story short, he had epilepsy and had multiple grand mal seizures I witnessed. And I used to tell him I was going to be a doctor to cure him.
Wow. Wow, that's amazing. What was his name, Dr. Nelson?
His name was Richard. And
Richard.
because of him, I had I have a son named Richard Nelson,
Oh, wow. You
and
named
I
him
had
after your mother.
another who passed. One of my children also is Richard Edward, and my grandson is Richard Nelson Jr.
Wow, what a legacy. Not only the name legacy, which I think is completely amazing because when you say people's names, you bring them into existence again, right? When you say Richard, you bring him here. And that's totally amazing. And the fact that you do what you do and you help people in the name of Richard. I think that is so fantastic. I really, really do. And I'm wondering, do you think about him on a daily basis when you're with your patients?
Often enough, uh, yes.
Wow, that's amazing. I am surely grateful for Richard because if it weren't for Richard, we would not have you here talking to us and teaching us about the carnivore diet. So that legacy in itself is just totally amazing. And yeah, I can't say enough about that. That is amazing.
Yeah. And, of course, I didn't, this, I'm talking about the 60s, and I
Mhm.
didn't know this back then, but now looking back, he could have been treated with food
Right,
for what he had, because he had an encephalitis, so that, like I always put it in simple terms, basically fried his brain, and he was what at the time was called mental retardation. Today, he would have probably been diagnosed with being on the spectrum,
right,
uh, autistic
right,
spectrum, and had the seizures. Now, we've known for over 100 years that a ketogenic diet would be very useful for epilepsy, and now
right.
we know anything brain related. Uh, you can assert nowadays that gets better with a ketogenic diet.
Well, from what I understand, when when we are put into ketosis, that is the optimal fuel for our brains to most people are sugar based. We're going in one direction. That we have two fuel systems, right? From what I understand, one is a sugar. We can eat sugars, carbohydrates, and fuel our body, fuel our brains until it gets a little bit rough, right? Or we can go the ketogenic route. And people go into the ketogenic fuel system by fasting and by following the carnivore diet. And what they find for children with epilepsy is that when they follow a ketogenic diet, they fuel their brains with what they need. And I'm starting to look into that as well with multiple sclerosis. I was diagnosed with multiple sclerosis, and it's called hypometabolism. That is a word that I just came across by Dr. Ben Bickman, and he's talking about Parkinson's disease, um, autism, uh, encephalitis, and um, and epilepsy. These conditions can be treated with a ketogenic diet. And I'm wondering what you think about that, Dr. Nelson.
Oh no, I am not surprised, but I'm at the same time amazed,
Yes.
um, with the field of metabolic psychiatry, as they are calling it. Read a couple of books on that as well. And I have had my own experience because I did have a stroke 6 years ago,
Oh my goodness.
and it left me with a little bit of weakness. I improved, maybe 95%, few years, but once I started my own journey with a very low carbohydrate diet, and then it went into a carnivore diet, my weakness or perceived weakness at the time, I cannot notice it anymore. I'm right handed. It was the right side that was
Oh
affected.
my.
I have a little scar there somewhere in my brain on the left side.
Yeah.
And I can no longer feel a difference in strength. And I did, for about 3, 4 years after, uh, what's going to be 6.5 years ago. I had the stroke in the past 2 years. By the way, today is 600 days carnivore.
Congratulations. This is your 600th day carniversary.
Yes.
So, congratulations on that. You are a little bit ahead of me. I'm coming up on a year, March 5th. Um, and I just can't wait. I can't wait to hit what you're hitting. 600 days is just the gifts just keep on giving, right?
Yeah.
You talk a little bit about that, like what gifts has the carnivore diet given you?
I have completely reversed my hypertension. Uh, I was on very large doses of uh, medicine for hypertension, specifically metoprolol, 300 milligrams a day. Um, as a physician, I usually don't have patients on more than 200, and most doctors don't go beyond 200. I needed to take 300 a day to be able to control my blood pressure,
Wow.
along with like Cinepril 40 milligrams.
Right.
Uh, when I started at the beginning of 2024, I started basically just reducing carbs. I was very familiar with the Atkins diet, right, and the low carbohydrate diets.
So that was about 2 years ago. So 2 years
Yeah,
ago, you just started
right.
Atkins, low carb,
Yeah.
keto.
And
So
then 6 months
what were you
later,
eating?
I went carnivore.
So what were you eating when you did that?
Uh, Most of the things I was eating: broccoli, cauliflower,
Mhm.
a little bit of tomatoes, cucumbers.
Right. And keeping your
Uh,
carbohydrates where? Were you counting carbs?
I wasn't counting carbs
Okay.
because what I mentioned was mostly what I would have as far as
Okay.
vegetables.
Yeah.
And I knew that, I was eating once or twice a day when I decided to give up my indulgences.
Yeah, so like the real sweet, carby stuff, you just kinda gave that up, which I can imagine. So I know that you've told me that, you are of Puerto Rican descent, you're from Puerto Rico.
Yes.
So how was that? How was that, like, giving up all those cultural foods,
Well,
right?
for you, first of all, as any if anyone listening is from Puerto Rican ancestry or know what we eat
Yeah,
normally, first thing is rice and beans. Rice and beans. Growing up, I had it uh, at lunch in school. It was what was served always, almost always rice and beans, and at home rice and beans at least once or twice a day. So, and then we have a lot of tubers or roots
yeah.
that we eat in the Caribbean, and
A lot of squashes too, right? There's a lot of
yeah.
yeah. So it was a
So
very high carbohydrate diet that
yeah,
you were raised on. And
and I
then
been I don't know if I've been vegetarian
uh-huh.
at home. There would be some meat. It varied: chicken, turkey, uh,
But probably not a lot,
salmon.
right? So it didn't take up a lot of your plate. It was probably
No, no.
more carbohydrate and then maybe a little bit of meat.
Yes, that's exactly what it was. It was rice and beans first, always,
Right, right.
and
It's a staple of your culture. So then when you're deciding, "Okay, so, this is getting out of hand, and I really feel as though I need to cut down on my carbohydrates," and you start did you give up the rice and beans, or did you just have a little rice and beans? How did you do it?
so I've been aware of low carbohydrate diets and the Atkins diet for many years, over 35 years, I guess, 32 maybe. Um, and I had used it with my patients as well, recommending they cut the carbs, right?
So you
And
recommended the Atkins diet to your patients?
a variation, basically.
Okay.
Uh, Patients are always very reluctant to cut out what they typically eat or like. But once I became diabetic, I also knew, that I needed to reduce rice and beans. Doesn't mean I stopped eating them, but if I wanted to lose weight, I knew I needed uh, to cut all those carbs and bread.
Right.
So I've always tried to limit or restrict the
Yeah.
amounts of those
So
things.
what was it like for you? I'm just wondering because what was the, emotion or maybe the thought, the feeling that was connected with giving up carbohydrates? How did you reconcile that?
So finally, at the end of 23,
Yeah.
I was basically sick and tired of being sick and tired. I had the hypertension, diabetes. I had had the stroke,
Wow.
uh, plantar fasciitis. I had four different reasons for numbness and tingling. I just mentioned the stroke, but I also had had a back surgery in 1987. Uh, 2.5 years ago, I was almost in a wheelchair. Oh,
Yeah.
year 22, I fell a couple of times at work.
Mm.
I would have to use one of those electric carts if I ever wanted to walk around. There were days that I was so bad that not even pushing the cart was enough. I needed to sit to be able to go around the big box stores. So
And
if
what was that like? I mean, here you are, you've always been it sounds like that you've been pretty active and pretty, engaged in life, and then all of a sudden, now you're not able to walk in the grocery store. So
yeah,
what was that like?
it was very frustrating,
Yeah.
number one. And, you know, you sit in those carts and you're weighing 310 pounds. People look at you and you notice, right?
Mhm.
But this whole thing was gradually getting worse and worse and worse. And at the end of 22, beginning of 23, I said, okay, I got to do something. So
Yeah.
I went on a very low carbohydrate diet. Over the next 14 months, slowly, and in the middle of that, I went carnivore. So slowly reducing. We were talking about the blood pressure medications, and finally,
Wow.
February 14th, as a matter of fact,
Valentine's Day.
which was last Friday, was a year ago, the last time I took blood pressure medications.
Wow, so you've been off of all blood pressure medications for 1 year.
Yes.
That is totally amazing. And what is your
I,
blood pressure like now?
the last time I took it was like 115 or something like that.
That's
It,
amazing.
yeah, no, I completely reversed my hypertension.
Okay.
I was also using, because if I wanted to eat some rice and some beans and some other stuff, or the apple fritters, which
Oh, geez.
was one of my favorite things. I would stop to put gas in the gas station, and oh, apple fritters. I'll take one for my wife. I'll take one for me, and one extra one. And sometimes I'd get home and I would have eaten all three of them.
So when did you do this? This was pre-carnivore, right?
Of course, of course.
Okay. All right. Just I'm
Before
just
doing
checking. I'm just
before
checking.
before doing all that, but
Yeah.
that was what happened. Uh, so I was also using over 300 units of insulin a day to be able to keep my blood sugars under control. In
Right.
total, I've stopped about 7 prescription medications. There are three.
Wow.
There are four things that I still use, and three of them I could have eliminated them, uh, but because they have been researched and repurposed, and they are all prescription medications that are still used
Mhm.
generically, but they do have some anti-cancer properties. And a year and a half ago, I had a little fight with that. They
So
removed the
you were
tumor.
diagnosed with cancer?
Yes, bladder tumor,
Bladder tumor.
remo- removed in November of 23, and I used fasting. I used a carnivore diet.
Mm,
I used multiple other things. Dr. Seafried on Dr. D'Agostino.
right.
Researched a lot, communicated with them, and used their suggested press pulse approach. I don't know if you're familiar with
Yeah.
that, but
Why don't you tell the listeners about that a bit?
I think the long story short is
Okay.
you need to be in ketosis for as
Yeah.
long as you can when you're also fighting with cancer. So obviously, they do recommend a low carbohydrate diet, and sugar feeds the cancer. So you need to eliminate the sugars and the carbs, basically, that are helping to feed the cancer.
Right. So that's what I heard too. I heard that the fuel system for cancer is sugar and carbohydrates.
Yeah.
And a lot of
And
people are just cutting out the sugar and carbs, and they're having a lot of success.
so the way I explain it to patients so they understand this concept,
Right.
'cause I usually don't have more than a few minutes
Mhm.
to convince them that this is an important part of the puzzle. Let's say it's a big puzzle. There are many parts moving. One of the parts is the fact that cancer cells run on sugar.
Right.
Okay. They use your glucose. So if you're consuming an excessive amount of carbohydrates, you're creating a perfect substrate for the cancer cells.
Yeah.
Now, they don't know how to use ketones. So if you have more ketones in your system, uh, that helps starve them, I guess. I am not saying this is the treatment for cancer, but definitely is something that helps.
Like
And
an adjunct treatment to,
yes,
um, what the medical system can do for us.
yeah,
By going on a ketogenic diet, you can help the cancer not to grow. Is that
definitely. And that's a growing field, a metabolic theory of cancer.
Mm,
It's something that if you're dealing with that, you want to research a lot. But what I was going to say, I explained to patients what a PET scan is and what it's used for. PET
mhm,
scan usually is a PET CT scan
right,
that is used to determine if you have cancer or metastases, right? And what they use, they inject you with a radio labeled molecule called FDP.
FTP.
FDP is fluorodeoxyglucose.
Ah,
They inject you with a radio labeled sugar,
mhm,
and then they look to where it's absorbed the most. And when you have a hypermetabolic spots, they can tell, oh, that's cancer.
right, so the
Because
sugar goes to where the cancer is on the
because
scan,
the
so
cancer
they can
the,
tell where the cancer is. Okay.
the cancer needs the sugar. So, uh, however, even though this is a phenomenon discovered over 100 years ago, they call it the Warburg effect, and
Mhm.
Dr. Seifried in past, I don't know, 15, 20, 30 years has been researching this aspect. A lot of cancer doctors don't go for that. They don't believe that. They don't think it affects. Many physicians don't. Uh,
Why do you suppose that's true? Why do you suppose doctors don't believe that sugar plays a part in cancer?
I, I I don't know why.
Yeah.
Because when it was explained to me the first time I found out about this several years ago, it made sense.
Mhm.
Now, right now, I can show you statistics from a study called the Arista study, where, among other things, they showed the increased amount of cancer rates in diabetics go higher as your blood sugar gets more out of control. So higher hemoglobin A1Cs are correlated with higher amount of cancers.
Do you think
And
that higher A1C and higher insulin levels, blood sugar levels can be attributed to many diseases that we all seem to get in the modern era?
I think the common root of all of them is chronic excessive carbohydrate consumption.
Yeah.
We're eating too many carbs,
Mm,
and there are essential proteins, so we need essential amino acids, so we need proteins, right? There are
yeah.
essential fatty acids, we need fat. There's no essential carbohydrates. We don't need carbohydrates. Our body is so intelligent designs uh, that makes whatever glucose it needs. So you don't have to eat glucose to have glucose in your blood.
How do you get glucose in your blood without eating it?
Your liver makes it. Takes some of the glycogen, basically is the glucose stores, and your liver will make uh, glucose when it needs. It can even take the fat from sugar. You can make fat. From fat you can make sugar.
Wow.
Uh, Fats, uh, triglycerides are basically three fatty acids with a backbone that is glycerol. So you
Right.
turn it into sugar. So
So in
uh,
other words, we don't have to eat sugar and carbohydrates to get sugar and carbohydrates. Our body will make what it needs at the time.
there is no absolute need to
It
have
doesn't need it.
carbohydrate.
No.
Yeah, no. You do
Okay.
need protein and fat.
Okay.
You don't eat protein, you die. You don't eat fat, you die.
So
Eventually, may not, you may not die the next day, but
you're not going to run optimally, right? You're not going to be a superhuman
yeah.
when you don't eat protein and fats because that's what our body needs.
So as far as I did have the tradition. I had a surgery and then I had treatments,
Okay.
but around my treatments, I did some fasting before and after the treatments, and
Wow.
some additional supplementation, and I was checking my ketones more frequently. I wanted to
Okay.
be at good level of ketosis throughout uh, the days around my treatment. So uh, if you ask my urologist, he's gonna say, "Oh, surgery was life saving, and the immunotherapy that I had was life saving, and that's what cured your cancer."
Of course.
And he might be absolutely right. I don't have the proof that it would have been different, but I do believe I set uh, my biochemistry in the right position to help along. And there is a lot of research going on behind that as
It's
well.
it's really amazing. The research that's happening is really amazing. And I, for one, I'm so grateful that you did that, that you listened and that you followed the ketogenic diet and supplemented your treatment with it because we have you here today and I get to talk to you and I think that's fabulous. I think that's wonderful. So you've had multiple health issues along the way that probably could be attributed to a high carbohydrate diet. And throughout your life, these things,
All of them can be
all of
achieved.
them. So, and it took you illness after illness. Um, the weight blossomed up. It took you until the point where you really didn't have a choice. Well, you did have a choice. Everyone has a choice, right? But you made a decision. You made a decision to live.
Yeah.
And you really looked at it and and in my I'm really interested in what brings people to first hearing carnivore and then rejecting it and then hearing carnivore again and letting it kind of marinate in the brain, kind of learning about it. And I have certain stages that I attribute. The first one is called carnivore is crazy. We say the carnivore diet is crazy. We're not doing it. That's stage one. Stage two, I call the spinning circle. You know, when you turn on your computer and you're going to a program and the computer spins and spins
Loading.
and it's loading. Yeah, loading. So that's stage two. And I call stage three the challenge. And people tell us, try it for 30 days. That's the challenge. Did you have a challenge? Did you have a 30 days? I'm just going to try this thing, see if I
I
live.
I I do have a story around that.
You
It
do.
had to do with condition I developed. So on June 12th, I go to the eye doctor, have my eye checks. I'm diabetic. I do it with certain frequency. Had never had a problem, and she tells me, Nelson, you have some macular edema.
Ugh.
Uh, One of the first changes that can happen with all kinds of different retinopathies, but I happen to have been using for a year and a half a GLP-1 because I was diabetic. Uh, Long story short, that GLP-1 didn't help me. My A1C was 6.7 before I started it, and 6.7 at this point I'm talking about, uh, over 1.5 to 2 years. And she says, you have macular edema. And immediately I said, okay, I'm not going to go blind. I have to do something about it. And my motive, my first thing I'm thinking is my daughter in law, who's married to my Richard Nelson. We call him Ricky because we used to call my brother Ricky. She's pregnant with who it's now my only uh, grandson. But at the time, she's pregnant with this little.
Oh my goodness. Look at him. Oh my gosh, he's
and
beautiful.
and I say, I gotta see my grandson.
You have to.
I'm not gonna go blind. So I'm already very restricted on the amount of carbohydrates I was consuming at the
Right.
time. I mean, like I said, I have some broccoli, I would have some cauliflower, pickles, olives, avocado, and what else can I do to improve and my A1C was still, even after 5 months doing a ketogenic diet, my A1C in May prior to that June 12th had been 6.7. So
Still.
that GLP had not helped me. I had not lost weight with the GLP until I changed the diet. So I started searching on YouTube, the on YouTube University, and
I
I,
went to that school.
because I had searched a lot more on ketogenic diets and particularly the doctors, and I find someone who's not a doctor. He's just interviewing someone else. This
Ah,
was this was Kerry Mann from Healing Humanity,
know him well.
and he's interviewing Sean White. Massive amount of weight loss,
Yeah.
but also anxiety, depression, the mental health improvements. And I knew that people like Joe Rogan and Jordan Peterson, his daughter Michaela Peterson, were eating only meat. But I thought what you just mentioned before,
Carnivore is crazy.
they are crazy.
They are crazy.
You know, 60 plus years of programming that you needed to have vegetables, otherwise you're not healthy.
That's right.
And I said, well, you know, I'm gonna try that. It just I I said, so that was June 29th,
June 29th.
and
You
June
decided to give it
29th.
a try. Did you put a time limit on it? Am I gonna try it?
No,
You just said, "I'm gonna try it."
maybe I said to myself, I'm gonna try this for 30 days.
Yeah.
I just said I'm gonna go for it. So 3, 4 days
Wow.
later, I wake up one day, I'm not hungry at all. Not hungry to the point that I said,
How long
I'm
after
not
that? Do you remember
uh,
how long after that was? Like, when like, you
three
started the
3 or
carnivore
4
diet?
days. It was 3 or
3 or
4
4
days.
days. That's
Yeah.
amazing.
Now, I had already been restricting the amount of carbohydrates uh, since January. So I wasn't eating, if I guesstimate, yes, I was eating less than 20, maybe 30 some days. carbohydrates.
So you'd been doing this gradually. You've been
Yeah,
falling into this.
and for years I had on and off used it to lose weight. I used it to for yo-yo dieting.
Right?
Basically, I would lose 40 pounds. Hey, I made it, and I would start eating again, and of
Yeah,
course
I know that
regain it.
story. Yep. Yo-yo.
So 3 or 4 days after going carnivore, I I'm not hungry. I woke up one day. I think it was July 3rd or something like that, before the 4th of July, and I'm not hungry. I'm not eating. So that was I naturally fasted. I was eating once a day, so it was basically a 48-hour fast without even blinking. Uh, I
Wow.
had food the day before. Woke up one day not hungry. I didn't have food until the next day.
So by cutting out the carbohydrates, you didn't have the hunger signals, which I would argue they're more of craving signals, right? Because true hunger, you still have true hunger, but you know when you're hungry and you know when you're not hungry.
Mhm.
But after 3 days on the carnivore diet, your hunger signals became more real and your carbohydrate craving signals were gone.
Yeah.
That's totally, totally amazing. So, when did you notice or have you noticed any difference in your eyes?
So I had another exam 6 months later, and one eye was about the same. The other eye was better,
Excellent.
and I haven't. They closed that office, so I
Okay.
haven't found a new place to be seen. But overall, my eye said that this is subjective.
Right.
Is better
That's
because
awesome.
I think I see better, but I haven't gone back after that second time. But the second time there was some improvement in one of the two eyes,
I would be
and
curious,
and
if you made an
within excuse me, within just 2 or 3 months, my A1C was 5.4.
wow.
Once I went carnivore, and I have maintained basically. I think I've done it 2, 3, or 4 times. And it's been 5.4, 5.3, 5.4, 5.4. Those are the last four measurements I've had.
What
So,
what what is the tell if you let people know what the cutoff for pre-diabetic, what is the number that they say?
5.6 is normal, 5.7 is pre-diabetes.
And you were 6 point
I was 6.7, and that is considered a good number, an under control number.
that's crazy to me,
But
but it is
I
diabetic.
I have since decided to call what people call pre-diabetes, and this is just a Dr. Vazquez definition,
Okay,
stage 1 diabetes, because
that makes sense.
one the studies are showing that once you go beyond 5.5, 5.6, you get to 5.7, all the graphs about the increased risk of cardiovascular events, heart attacks, strokes, cancer, all cause mortality,
Right,
they go up, they skyrocket.
right,
And so some people develop all these complications way before they become diabetic. Diabetics are diagnosed at
mm,
6.5. It's one of the four criteria that has A1C, by the way, has been a criteria only for 15 years.
yeah,
Before 2009 or 10, there were three other criteria which are still valid for the diagnosis. A1C just becomes easier
right,
because it's a test you cannot cheat.
and
If you
it's one
it,
test that's a
it,
doctor
it
can look at.
it gives you a 3 months uh, look back about your glucose averages. But anyways, so yeah, subjectively, I have improved. I need to go and do another check to
That's
see.
what I was gonna say. I would love it if you could, let us know and go get another test and let us know what the doctor's saying. Because I think you would find it was totally amazing.
And
And you get to see that little baby.
it's not only the A1C, but my blood pressure is better, right?
Yeah,
My sugar control is better. I
the gifts.
basically have gone on a lot of medications, including I used to have chronic pain.
Mm. No more.
No, no
No
more.
more. Wow, that is amazing. Your story is, it just gives us something to hope for, and it gives us, an opportunity to look at ourselves and the things that we want to improve in ourselves. And, I just thank you so much for telling your story, to being vulnerable so that we could all learn from you. And, yeah, I wanna thank you for that. So, um, I wanna just tell the listeners where they can find more about you. So what is your YouTube channel? I see it right there at the real Dr. Nelson,
At
is
the
that
real Dr. Nelson, if you search for that on YouTube, Facebook, TikTok, Instagram, it's either that or variation of that. I think
okay,
one of them I had to put the real Dr. Nelson Vasquez because the real Dr. Nelson was taken.
yeah.
I don't know who, because I'm the real Dr. Nelson.
I totally get it because there's
Uh,
an actress by my name that she took everything from me, and then I went to do Boston Carnivore, and there is another Boston Carnivore as well. So that is a
okay.
big problem if you have a name that's very popular. So I want to also let people know that they can find you on Dr. Anthony Chafee's channel. You have an interview with him. You had an interview with Dr. Sean Baker, Dr. Tony Hampton, Dr. Robert Kiltz, Carrie Mann at Homesteadhow, and Alia Wells also interviewed you. And so if you want to check Dr. Nelson out, you can find him in those places. And his story is just absolutely amazing. But now I want to play a little game with you, if you are game to play a game.
By the way, in the mornings, I'm frequently in Dr. Kilt's channel.
5 a.m. I joined them once. I'm telling you guys, it's early. It's really early. I think you need to live like in Europe to
I wouldn't, by the way, I would never have the energy to be up at that time in my previous life eating everything.
Yeah.
Yeah.
No, I hear you. I definitely hear you. So this is a game that I call Carnivore. I don't know if you can see it. Fact or fiction. Okay. So the first statement, Dr. Nelson, is, let's see if I can do this. Humans need to eat vegetables. Fact or fiction?
Well, the short answer is not really.
Not
Okay.
really.
Now we can eat fruits, vegetables, and all that, but uh, there we mentioned this a little bit before. There's no essential need.
So we don't
You
need
can
to.
you don't need to have vegetables, and even if you consume them, you would have to cook them real well. Uh, Raw vegetable, the raw diets that raw paleo and raw vegan, and basically you're consuming all the oxalates, phytates,
Yes.
lectins, and all these
And they're not good for you, right?
anti-nutrients that straight from the plants. If you're
Yeah.
gonna eat them, you need to cook them well.
Right. Right.
And
So I'm
yeah,
hearing that you can eat them if you cook them well, but you don't really need to. You can survive without them.
yes, and many people discover um, if you eat beef, salt, and water, right? Michaela Peterson coined this the lion diet, right?
Yeah.
And it's the ultimate elimination diet.
Yeah.
Okay. Well, the ultimate would be just go fasting for 40 days and and
Not too
then
many
read.
people can do that.
Yeah,
Yeah.
but it is a extreme elimination diet. But you discover then by adding foods back which ones you may be sensitive to.
Right.
And I have discovered several of them. Okay.
Yes. And you can only figure this out if you get rid of everything
Hmm.
and then add one food back at a time. Because then you
I,
know who the culprit is, right?
I was never big on black pepper,
Yeah.
but definitely that's not a food that agrees with me anymore. And
Yeah.
black pepper is basically a spice that you
It is.
use.
It's a plant. It's a plant. It's a
And
vegetable.
now, one that actually surprised me was something I liked a lot: garlic. Love garlic. I love,
Me too.
I'm also a cook. So when I used to cook more vegetables, they'll be heavy with garlic.
Yeah.
Uh, doesn't agree with my
I
stomach
don't like it. I don't like the
that
smell of
much.
it, and I can tell when
Oh,
people eat it. It's not something that I enjoy anymore. But
I
I
don't
wanna get
I
through
don't
these
mind.
questions. I wanna get through
I,
these questions. Here
okay,
is
go ahead.
the next one. It's humans require fiber.
So that's well, no. Is the answer is no,
So
but
it is it's fiction. It's not
yes,
fact, right? It's
yes,
fiction.
yeah.
Okay. So why is it fiction? I'm so sorry. Is this
Well, this is the thing. I'm traditionally trained. I'm a primary care provider. Allowed. I would have to say I allowed pharmaceutical companies to teach me about things, and it's a complex question. But the bottom line is, you don't need the fiber. Now, I've had people tell me, no, I could never do that because then I'm gonna let that meat rot in my intestines there, and I'm not gonna be able to flush it out. And you know what? You get your meat digested completely and
right,
absorbed without almost any residue before it even gets to the colon.
right.
Okay, between digestion starts in the mouth. You start chewing, you swallow, goes to the stomach, acids mixed with enzymes and bile acids from the pancreas and the liver, and then it goes through the three portions of the small intestine. Everything is pretty much absorbed by the time you get to the colon. Okay. However, when you eat fiber, you do see it all the way out, right? Particularly if you like to look at that, you notice it with corn, and if you look
From,
closely,
like,
you
6
notice
months
it
ago,
with.
right? You've got corn from, like, 6 months ago that comes out. It's like, I didn't eat corn recently.
So
Alright.
no, there are no good studies that prove that, and there are multiple studies that show, for example, in people with IBS, ulcerative colitis, and Crohn's disease, which are intestinal problems, that they get better with no
So,
fiber.
yeah, we don't need it. We don't need it. So it's definitely a fiction. So I'm trying to think. I'd like to get through these. So the next one is something that I hear all the time, and tell me if it's true. LDL cholesterol is bad. It's bad. Bad cholesterol.
So I've had to change my mind a lot on that because
Yeah. We all
uh,
have, right?
yes, um, LDL cholesterol is not cholesterol, by the way. The LDL is a lipoprotein that carries cholesterol.
So it's like a
But the
bus.
bottom line is you need to do your research about that one a lot and open your eyes.
Mm,
LDL cholesterol might be associated when there is heart attacks and strokes. Uh, the association of that risk is so minuscule when compared to A1C and
mm,
diabetes and the obvious metabolic dysfunction catastrophes,
right. But do you think it's
which
because
is which is 11 I can cite you one statistic: almost 1100% more risk with diabetes than LDL cholesterol. So I
eleven
don't think it's a
hundred
significant
percent 1100 did you say 1100%?
1100%. Yeah.
That's a lot of a percent.
Yeah.
That's so having diabetes is much more a risk factor for heart disease overall.
Yeah. More than 11 times more than the general
Wow.
population. If you
Wow.
if public is one and the cholesterol is, this is out of the Women's Health Study. Someone evaluated all
Right, right.
the statistic. Anyways, let's go with the questions because uh, that explanation can get long.
Well,
But
you answered a couple of these. I'm gonna end with this one, and, you might find this I hear this all the time. The carnivore diet is not sustainable.
I've heard that too. I had a. I'm not gonna give too many identifiers here, but I had a person who had PCOS, and wasn't a patient. I suggested ketogenic diet, a very low carbohydrate diet, and
Mhm.
no, that's not sustainable. Along with, I'm gonna have to give up the foods I like.
Mm.
Okay, I don't know. When there have been some relatively good studies comparing the sustainability of the low carbohydrate diet, they do better. It is
So
more
it's more
sustainable
sustainable.
than calorie restriction. I said about word calorie. Uh, than calorie restriction. Okay, it's more sustainable than going through a bariatric surgery and then disfiguring your GI tract, and now you have to live with whatever complications. But yeah, uh, human behavior is very difficult to change, and
It is. It's because we're thinking, feeling human beings, right? So it's not like we're, locked in a room and someone's feeding us. We make decisions
and
about what we eat every
it was
day.
for me. I'm guilty of that as well. I
Have you found this sustainable personally more than
Yeah,
anything else that you've done? Because I
yeah.
have.
It's so much easier to prepare and cook and eat.
Yeah.
I don't have to be looking for all the fixings.
No, it's simple. Your decision is made for you.
Yeah.
Right? I attribute it to, like, the difference between taking a train and driving in my car. When I drive in my car, I have to make decisions all the time, turn left, turn right, put my directional on, put my brake on, go faster, go slower. All these decisions that you're making on a calorie restricted diet, you might end up lost. You might end up going off road. There's a lot of possibilities. But when you are eating a ketogenic carnivore diet, you're on a train. There are tracks that are keeping you on track, stable, that the train is getting you where you want to go. And you just sit back on the train and you eat meat. It's so, so easy. Look at you. Look at that man. Look at him. This is what happens when you follow the ketogenic carnivore diet. This is what happens. And I want to thank you so, so, so very much for being my first guest here on Boston Carnivore. It was amazing. I had such a great time talking to you, and you were a lot of fun, and you played the game with me, which is a lot of fun. I love that. And again, tell people where they can find you, Dr. Nelson.
At the real Dr. Nelson in YouTube and Facebook, TikTok, Instagram. There's not a lot of content there, but there is some. I also have another Facebook page called Metabolically Healthy Again.
Metabolically healthy again. That's fabulous. That's what we all want to be, right? We all want to be metabolically healthy. And thank you, Dr. Nelson. It's been a pleasure.
Thank you for having me. It's been a pleasure for me.
Okay. Thank you. Bye-bye.